Hi guys, so we're going to talk about working with challenging situations, and all of us have experienced that at one point in our professional careers. Our clients, a lot of times they're really wonderful and sweet, but things happen. Sometimes they're just not wonderful and sweet. So we want to use, there are skills out there, and there are ways to deal with situations and ways to de-escalate conflict. So we're going to talk about conflict escalation first and what happens and how a situation gets out of hand. And we're going to talk about our clients' behaviors. So a lot of our elderly clients have behaviors, especially if they have dementia, or as we all know, if they develop a UTI and all of a sudden they're like off the wall crazy. We want to talk about the potential causes, and some of them may just be medical. It may not be a situational type of a thing. We want to talk about techniques that we can use, and then we'll just review some key points. So there are 7 signs of conflict escalation. The first one would be an early warning sign. So it just might be mild irritation or subtle changes in facial cues, a tone of voice or body language, but they're subtle. Maybe we think, the client's just getting a little aggravated, or we don't even pick it up because we're so busy and so distracted that sometimes this whole early warning sign we can just gloss over because we have other things that we're thinking about. But these are going to be the beginning signs of the escalation. And then there's going to be anger, because the anger is going to develop from this aggravation and this irritation, and then there's going to be accusations and blaming. And we all know, when we get angry, none of us want to blame ourselves for whatever the situation is. It's just our human nature to blame someone else for a situation that we're in. A lot of it is because we are out of control, and we're going to talk about that a little bit more later. Issues multiply. So all of a sudden it was just one problem that was bothering them, and all of a sudden now, it's also this, and I can add this to it, and maybe now that I'm thinking about it, it's also this. So things multiply as the escalation progresses. And then generalizations become issues. Things become clouded, nothing is right. It's no longer one specific behavior, one specific trigger. It's the whole world is aggravating me. Everything, I'm aggravated about everything. All you have to, say is one thing, and then everything becomes a problem. And then goals shift. And it gets to the point where they're so frustrated, so angry, accusing, feeling so many things are going wrong that you don't want to resolve it. It's just like you want to hurt something. I've seen people put their hands through walls, right, as a reaction at that point, because there's so much pent up anxiety, frustration, and anger that all they know how to do is express the anger. And then there's taking sides too. And again, this is more if there's more people in the situation than just you and the client. But again, people start to take sides. It feels like a war. It feels like, he said this, but you said this, and and it's back and forth and back and forth and back and forth. And then finally there becomes an impasse. No one wants to communicate. No one wants to cooperate. No one wants to resolve the conflict. Okay, so that's the escalation point that we want to avoid. That's the pattern that we want to avoid when we're dealing with conflict escalation. So we're dealing with the elderly. There's lots of common behaviors that we deal with commonly. So there's resistance for showers and hygiene. It may just be, as we're here in Ohio and it's cold, it's dreary, and it may just be something like the weather outside. But there tends to be resistance for showers. They tend to not want to get cold. They tend to not want to bathe, okay? Another behavior would be a refusal to let you help them in general. They may just be cranky. They may have gotten out of bed on the wrong side of the bed, gotten out on the wrong side of the bed. They're uncooperative. They just don't want to be bothered. They get cranky about it. There's a refusal to take medications or to eat. Sometimes there's just that abstinence there. I'm not going to do it. I don't care if you're telling me it's time. There's constant complaining. A lot of our clients will complain constantly, and it can be annoying for us and for them. Clinging behavior. Sometimes our clients just really want us there. And there are reasons for these behaviors, and we need to ascertain what they are, really. There might be demanding behavior. And there might be verbal abuse. So we want to remember that habits are formed over a period of time. It's a pattern of interactions, right? And those interactions are really, really hard to break because it's happened over and over and over again. And we internalize these patterns of behavior. And so repetition is crucial if we want to break a pattern of behavior. We need to consciously do the behavior that we want to do in order to make that behavior become our pattern. I know when I was teaching yoga, we used to say 42 days. It takes 42 days of consciously engaging in an action before it becomes second nature to us. You've got to keep doing it. So when we have a pattern that we want to break, it's really, really hard. So we have to consciously try and break that pattern too. And to institute a new pattern, we have to repeat it and repeat it and repeat it in order that it becomes part of our awareness. More behaviors. So paranoia, hallucinations, delusions, confusion, especially in our dementia clients. These are all behavior patterns that we see that are going on because of the cognitive changes in their brain. There's a withdrawal from social interaction, a refusal to participate in activities. Sometimes it's because of isolation in general, but sometimes it's just an obstreperousness. You know, you want them to go do this activity in the room if they're in assisted living, and they say, no, because you want me to go, I'm not going to go. They might be forgetting, losing items, wandering, repetitiveness. Again, a lot of this is our dementia clients that we're dealing with. There can be self-destructive behaviors. And all of these behaviors really end up being self-destructive when it's a conscious, decision to be non-conforming. There might be sexually inappropriate behaviors from our clients. There might be aggression or violence. It might escalate to that point. And then sundowning is a big one that we see also with the elderly clients. We want to try to validate their experience. Okay, we don't ever want to try and take that validation away from them. We want them to understand that we accept that what they're feeling is what they're feeling. And that's the first step to understanding them. And we want to get the clients to focus on us, to try and maybe focus on interacting with us. So some of the questions that we want to ask ourselves when these triggers develop is it within the individual's power to control the behavior? Okay. Or do they need support? Do they need help? Because they really, truly can't control the behavior that they're experiencing. Does the individual have the skills to perform the desired task that we're asking them to perform? And is the behavior a way to avoid that task? Because they don't have the skills, and they can't say to us, I don't know how to do it, or I can't do it. Is the desire to perform the task there? Do they just not want to, right? I mean, is that why they're not doing it? And then the other question we wanted to do is that we want to describe the individual. We want them to understand that they are engaging in unacceptable behavior, and they may not understand that. To them, their behavior may be considered acceptable. So they may just not understand that they're engaging in unacceptable behavior. So these are all things that we want to think about in our own head when we're interacting with our clients and their triggers and the buttons are being pushed. So we want to isolate the cause of the behavior, and that's important. Is it physical illness? Is it infection? Do they have a UTI? That's the first question we want to ask ourselves about our clients, especially our dementia clients. Remember, our clients become incontinent. They don't smell that their urine is foul. They may not have the symptoms of urgency that we may feel as a younger person with a UTI. They're incontinent anyway, so a lot of them respond with this cognitive change to UTIs, and so we want to ascertain whether that's part of it. Are they diabetic? Or is their sugar out of whack? Are they having some kind of crisis because of that? Or are they dehydrated? That might also affect them as they get older. We know that a lot of our elderly clients don't drink the way they should. So we want to rule out as much as we can any type of physical consideration. Did they just go to the doctors, and is there a drug change, and is there an interaction that they're feeling? So it behooves us to know what's going on with them physically, as far as these behaviors go. Are they just simply in pain? Do they have a really horrible night? Were they up all night because they were in pain? Are they constipated? That's a big one for the elderly. They don't drink, they don't move, they don't eat roughage, they get constipated easily, and we all know constipation is really uncomfortable. And especially if you're dealing with a dementia client who can't say to you, I'm uncomfortable, I'm in pain, they're going to act out. It's going to be one of their triggers. Are they just dirty? Do they need to be taken to the bathroom and cleaned up? Is there too much noise? Did they get too little sleep? Is there a change in their routine or a change in their environment that's affecting them? Crowding. Sometimes that kind of situation can also be a big trigger for them. And are there changes? Are they depressed? Are they lonely? Is there stress, confusion, frustration, feelings of loss? Loneliness and depression is a big one right now, especially for these past 3 years. We're all feeling it, not just our clients. COVID has really taken a toll on us in our emotional well-being. And so it's taken a bigger toll on our clients, and we have to acknowledge that for them. I mean, loneliness and isolation are a big problem in the elderly just in general, but these past 3 years it's really been compounded. And medication changes, I've already mentioned that. Are there medication changes, and are there interactions because of the medication changes? So I'm going to play a video, and then we're going to run through some scenarios before we continue, just to see where you are right now as far as all of this goes. And so let's see.
Challenging behaviors, that's how we see it. They're misbehaving. They have problem behaviors. We've got to do something about this. Now, I'm going to call a timeout right now, because the biggest problem we have right here is you've already identified the source of the behavior. You're pretty sure it's them and what they're doing. Timeout. You need to take a step back and realize this is much more complicated than you think. And instead of being such a strong judge and jumping to conclusions, what I want you to do is back off and reframe this. I want you to realize that they're doing the very best they can to try to communicate with you, to meet a need, to express that they aren't liking what you're doing. And unfortunately, you simply see it as not getting your way. What you don't realize is that you started this very frequently in your effort to be helpful. Let me just say to you, you weren't as helpful as you thought you were. I didn't really enjoy the help you gave me. I didn't get it. So you have a choice right now. Are you going to continue to push your agenda to try to get where you want? Or can you take that step back and go, okay, well, this isn't working. Let me rethink. So what you want to do when you experience a behavior you're not liking, you need to, take that step back. Take a deep breath. Let it go, and realize now it's time to kick in the front of your brain and to become a really good detective. Try to figure out what might be driving what you're seeing, what you're hearing, what you're feeling, and what they're feeling. What maybe you're smelling and they're not picking up on, what they're tasting versus what you would be tasting. Because what you want to do is realize that you need to see it from their side. And once you see it from their side, you try to be in their shoes, figure this out. Suddenly, when you see things, hear things, experience things differently, and you make that choice, that decision to do that, the becomes an aha, because you can start to realize it's the setting, it's the care, it's the gem. It's who they were before this all started. There's lots of pieces to the puzzle. Your job, if you want to do this well and do this over the course of this condition, is to stop the judgment, time yourself out, and reframe this behavior. Go from a challenging and frustrating, I just don't understand why she's doing this, to pausing for yourself, getting some help, maybe getting somebody else to take a look with you, because maybe you just can't see it because of who you are and how it works. But what you're going to do is take that step back, look more broadly. And at that point, make a decision. What are they trying to do? Are they communicating unmet physical need? There's basically 5 of them you want to learn about. Or an unmet emotional need. Or are you seeing the emotional need, but you're missing the physical need? Or was it something that is happening in the environment or happened earlier today? As I said, complicated. So you need some training. You need to know what's going on and what's not going on so you can quit sitting in judgment and start using this. That's the best tool. That and your ability to bring people together to help you. So with challenging behaviors, it's not about them. It's about us and what we choose to do about this effort to communicate an unmet need and helping us figure out what is the need and how can we better meet it for success for both of us. Making a positive difference because we choose positive approach to the care. Now remember this lady? What do you think she's doing? You see her beating on the chairs, making noise, annoying people, and you know she needs to go to the bathroom. It's been a long time. You've tried to make her stop, but she won't. What if I told you she used to clean houses for a living? I'm going to try substitution and a positive approach rather than trying to make her quit.
Miss Leona. Well, hey there.
Get out, get your hand.
Get my hand out the way. You're trying to get them clean. Here, try this.
She's a busy woman.
There you go.
I'm going to try a substitution here.
I'll trade you.
Not yet. Show her.
Rub it with that. Can you rub it?
Yeah.
Here, rub
We're
it.
getting there.
Trade me.
Wait.
Trade me. Here you go. Take this.
All right, get it.
You got it. Now trade out. There you go.
Ta-da.
Now rub it.
Now I show her, and there she goes.
There we go.
People
Good.
are less annoyed, not
Perfect.
so much noise. And she's
Beautiful.
cleaning. Now I want to reinforce that. That's
Got
good. That's good.
2 more to go.
But I still haven't met
You're doing a fantastic job.
her unmet need. One more substitution.
Nicely done, Leona.
She needs to get finished with this
Boy, you are good.
so we can move on.
You get this one?
Watch me, I'm sneaky.
That's it. Good. Good.
I visually eliminate the task.
Whoa. Woo! That is beautiful. You did a fantastic job. Man, you're a good cleaner. Here. Thank you. All right, well, come with me and we'll sit down and take a break.
Oh, God.
I know you're ready for
I'm
one, aren't you?
tired.
Now, before she goes to sit down, though, we have a place to go.
Oh, girl, you worked hard.
Oh, God.
You are one of the hardest working women I've ever met.
Yeah.
Well, Lord knows. Let's go to the ladies before we sit down, though.
Okay.
Okay.
We changed the challenge.
Success.
Okay, so who wants to share from table 1 and read the scenario?
Okay, so our scenario says I was with the client for the first time. He had just been released from the hospital after a stroke and was also dealing with cancer. He was a very large man, over 6 feet tall and more than 300 pounds, and had difficulty getting around. He was getting ready for bed and wanted to use the bathroom first. I assisted using the gate belt, but while brushing his teeth, he started to feel dizzy and began to fall. I was able to hold on to him to lower him to the ground, hurting my back in the process, but I protected him from falling and hitting his head. His wife called 911 and the paramedics had a very difficult time due to his size, getting him onto the stretcher. They had to use the freight elevator to take him down to the ambulance. So we came to agreement that something that you can do is maybe like bring the toothbrush or toothpaste and stuff to his bed. Obviously, you know, getting him up, sitting him up because he had a stroke, using his stronger side, just assisting him there. And also we agreed that like the other caregiver or whoever was there should have like gave a better report maybe because it was obviously her first time and maybe that could have helped too. So she just know.
Or talking with the wife, asking the wife, you know, since he's having a stroke, you
Yeah.
know, what is it that he can or cannot do?
Mm-hmm.
You know, but before you suggest, well, you can only suggest it, bringing the toothbrush, toothpaste, bringing everything to him. What if he said, no, I don't want that, I still want to go into the bathroom? You know, so maybe try, okay, suggesting, okay, this is what your wife said.
Okay.
You know, and having the wife to come in, you know, with you, maybe that'll be a little bit, you know, better communication, you know, where she can tell her husband, no, this is what you're gonna have to do.
Okay.
That could be, yeah. That could be good, yeah.
That can go a long way,
It
having
really
it right
could,
there.
yeah. Oh, yeah.
You know, we have the last say so.
Yeah, right.
Right.
Right. And then sometimes, you know, things will happen and maybe the care plan needs to be changed, you know? Sometimes, yeah, maybe they started out being able to get up to go to the sink to do that, but
Sure,
with the
he had a
stroke and everything.
But
so-
even if the care plan wasn't changed, because Holman said the office hasn't had a chance to get in there yet because he had just got from, you know, the hospital. This is just my.
No, good stuff.
You know, still talk with the wife and to see what it is that he can't, what he was doing before and what he can't do now.
But
And then-
naturally, you
then
don't
she
go
will let you
in
know.
until the nurse comes in. If you go into the hospital and they come home, that nurse has to go in, and the stuff before aide's supposed to walk.
That was my next thing I was
But
gonna
if that
say.
doesn't happen,
Sometimes, yeah.
still ask the wife, what
Yeah,
is it
that's
that
true.
he
You'll
can't?
get you
Yeah, I
that.
come on that part. I'm
Yeah,
just saying, you know.
because really,
That
we're
doesn't always
supposed to have
happen.
someone go in, you should not be going by the first
What
time.
if it doesn't happen?
Yeah, because you don't know what to expect, you know, the first time, just like with me. When I first started, I was just telling them, I haven't even been here a year yet, but when I first started, they had me go into a lady's house that I didn't know nothing about. You know, I had gone to my first client and met her and everything and got to see what was going on. I had even went and shadowed with someone. But this other person, they didn't do that. They just said, here, this is where it is, you know, she lives, and this is what's what. And I got on the phone and said, no, I want someone from the office to meet me there because I do not know these people. I don't know what to do. And I don't want the client telling me what I'm supposed to do. I want my job to tell me what I'm supposed to do. So someone did come and meet me there. I mean, unfortunately, when I got there, the lady was up walking, talking, but I didn't know that. You know what I'm saying? I didn't know that.
Call
So-
the office, you know, still, if you're not familiar with them, especially if they just had a stroke
Yeah.
and they just got home, asking the office, well, I'm walking into this blindly, you know, this is what the wife has told me, could you all come out here? Because if you've never worked in the medical field before, you haven't worked in a hospital, you haven't worked in a nursing home, I have an eye, you have an eye to be able to see certain things. You know, not everyone does if you have never worked the floor
right. I've
before
been-
and all. But you can also let them know, I cannot transfer you, especially if you see something's not right with them, male or female.
Right.
I can't transfer you until I call the office.
Right.
So
And of
that,
course-
and that's a really good point for all of these situations. If you have a client that's coming out of facility,
Yep.
for whatever reason they've been admitted, then your client care manager should be giving you an update before you go onto that shift, even if you've worked with that client for 5 years, because there's going to be a change in their medical status, and there are going to be issues that you need to be aware of. And the only way you're going to mitigate any circumstance or any situation from arising is to have that information. And you guys
info.
should be always advocating for yourselves, because sometimes, you know, I'm making no excuses, sometimes it doesn't happen the way it should. But you call and you say, hey, this is a new client, or my client is just being discharged, what are the changes, what do I need to know, so that I can care for them effectively. It's a very good point.
I would not have walked that client to the bathroom, period, especially after having a stroke. I just would not have done.
Okay, scenario 2, who has 2?
We do.
Okay, perfect.
Well, I don't know if you want me to. Two.
A situation.
Right there,
and a-
two,
Oh.
honey.
What should you do? I had a client who didn't want me to care for his wife because of my skin color. First question. Our response was, LaWinda said, try, did I pronounce that right, LaWinda?
Oh, it's LaWanda.
LaWanda, I'm sorry.
It's
I knew
okay.
it was off. LaWanda said, try talking with them and assure them that you
With a
provide
smile.
excellent care.
Watch your facial expression.
Call
watch
the
your body
office
language.
if it doesn't work. And Kathy kind of had the mutual feelings. And then the next question was, I've also worked with well-to-do clients who talk to you like you are beneath them. Sure, you guys have had all these cases.
Yes.
And our response was, Luanda said, overlook it and converse with them. Kathy said, smile. How can I make it better? And I said, rise above it and just show mercy and grace and kindness.
And if there's if it's going to be a continued problem that you see,
Call the office.
Let them know you may need to. You might not be a match for
Right.
that client.
Right. That's
It's not
exactly-
just about skin color.
Yeah.
You know, it just might be okay. You're just not a match for that client. It is what it is.
Right.
And sometimes, also
Right.
because I've been a care pro before in the field, and a lot of times they talk to me that way. And
Sure.
and I've realized they talk to their family like that too.
Yeah.
Like
That's
I'll take
very
it,
true.
I'll take it
Yeah.
personally, and I like sometimes I internalize and I feel like there's something wrong with me.
No.
But then I turn around and they talk like that to everybody.
That's our true
So,
character.
Yeah, so that's just kind of maybe a little bit not taking it.
To heart.
So this is an important point, and it's one of
Good
the
point.
skills that we're going to talk about. We don't take things personally from our clients. You know, there are cultural background differences. We are professionals. We're going into their home to be a professional assistant for them. And we are the ones that need to maintain that professional behavior because our clients are not going to. They have their opinions. They're going to say what they want to say. It's their own home. And it really has nothing to do with us. It's all in their head. So we
But
need,
when you get to a
I'll
certain
let
age,
you read that one
in
because
life,
that's
you're
too
not
close to
gonna
me.
have a filter.
I know. And I understand that too.
As anybody
I don't wanna come across like a know-it-all.
Nah.
Right.
I have a client now, and the son, I was told, that has this persona like, oh, you're gonna be scared, he's gonna scare you to death, and he's gonna be mean and nasty to you. And I didn't get that. But I could tell he has that way.
Uh-huh.
But when I come in and I'm talking to the client I'm taking care of, everything that I do, I talk to that person. And the kids are paying attention to the fact that I'm talking one-on-one with my client. Y'all don't intimidate me unless you tell me I got to do something. I'll do that, no problem. But my client and me are, everything that I'm doing, if I'm washing you up, I'm letting you know what I'm doing. And they get real comfortable with me because I do that. And a lot of times, a lot of aides go in and don't talk to the client. They just go in and start pulling it. And the kids respect that and like the fact that you're communicating with their parent.
Absolutely. They do.
Uh-huh.
I mean, and we said this from the very beginning in the orientations. How would you feel all of a sudden if someone walked in and started undressing you without telling you what you're doing?
That happens
Especially
in the
if they have dementia, and you may be telling them, but they're not getting it. So you have to find ways to navigate that.
Yeah.
But be gentle with it.
Number 3.
Ray is over here. What should you do? My most challenging situation was working with my client and her overbearing husband. He was controlling, self-centered, very intimidated, and rarely listened to anything others had to say. What should you do? I'm waiting on everybody else.
Try to do what
Continue to keep talking to him, you know, including him in,
Try to keep talking
because,
to him.
you know, he might done had some people that didn't include him in. And
You know what I would
did.
do? I would say, okay, well, how would you like me
Like
to
to
do it?
do it, right.
Because I'm gonna do it any kind of way that you need me to do it. That's what I'm here to do. I'm not gonna come in to your house and tell you what to do with your wife or what I'm gonna do. It's whatever you need me to do.
Right.
Yeah.
And they kind of break the ice with that,
Right.
you know. So that's all.
Yeah, like what you're saying, it's like
Keep
what would be
including
best?
them in.
What would be the best for you?
Yeah,
Or what do you
because
want
they
to
feel like
with?
that people are coming in
to take over.
and taking over.
Yeah.
You have to kind of bow down to them, and then
How
they,
would you like me to do this?
then they
Right.
feel respected. you know?
Because I had my mother, and
It's like
God
a
rest her
relationship
soul, she
building,
passed
right?
away. But I took care of her, you know. But it was hard because she didn't want nobody else but me. And she had one caregiver, and she would come in, she said, she too big. I'm like, Ma, what's that got to do with her taking care of you? But it was just the way she felt. So me going in and me knowing to take care of my mother my whole life, I know how to go into somebody's house and let them have all control.
Exactly. And that's another point that we're going to bring up later. if we give control back to our clients, it's a situation.
Right.
All of us, when we feel like we're out of control, that sets us off.
Yep.
And that's the one thing we always want to remember. And that's going to come up later too. So this has been perfect, guys. Thank you so much. Now let's continue on with the slideshow. So behavior. We want to acknowledge the elephant in the room, and we're all really good at ignoring the elephants in the room, right, in general. But we want to acknowledge the elephant in the room. Hey, we're getting off to the wrong foot today. What's going on? What can we do? What can we do to make this better? Do you have a suggestion for me how to solve the problem? And that's acknowledging the elephant in the room. We're getting off on the wrong foot. What do you think we should do? How should we solve this problem? We want to use silence, okay? Silence allows the person time to clarify their thoughts and restate their message. It often leads to valuable insight and to clear understanding of the true source of the person's conflict. It lets them know that we're willing to listen to them. If we've got an answer back for them right away, we're not listening. We're engaging, we're talking. We're getting our own agenda going, okay? So a lot of times, just being quiet and letting them say what they want to say is going to say, hey, she's really listening to me. She's not trying to tell me what to do. Okay, I'm going to continue and we're going to get this worked out, okay? And we touched on this, wanted to touch on this body language. Body language is so important. 7% of our communication is the words that we speak. 35% of it is our inflection. It's the way we say it. I always say, Mom, come on. You already told me that. Well, I know my daughter's annoyed at me, right? And I don't remember telling her that. So I'm getting agitated. Honey, give me a break here, right? And then the other 55% is how we hold ourselves and how our facial expressions, how we hold our bodies. And especially with our dementia clients, right? They cognitively can't understand our words half the time, but they sure as hell can read our body language. And they know when we're agitated, when we're frustrated, when we don't want to deal with them.
Yep.
And we can read their body language. We can watch their escalation by watching how they're behaving and how fidgety they're getting and how agitated they're getting. So body language is something that I think is so important, especially when we're caring for people, right? And I always tell our, when I do our orientations, I always tell the young caregivers, or the older ladies that come too, if we all could just have a mirror and we could watch ourselves for 48 hours and watch our reactivity without anyone knowing that that mirror is there, we'd be surprised at how much information we give away in our daily life to people that we don't even mean to give to them, right? So body language is a big thing, and being aware of it, being aware of postures and gestures, it helps. And we want our body language to be consistent with our verbal language. So we need to stop. We need to stop and think about what we're going to say. We need to stop and think about how we're going to hold ourselves when we say it. And it's really, really important. And again, I already said it before, but we want to make eye contact with our clients, and we want to maintain that eye contact. Because if we're making eye contact and we're maintaining it, it's less threatening. I was just reading something last night, and they were talking about animals in the wild. And I don't remember which animal it was, but if the animal comes at you and you make eye contact with it, it may not attack you. But if you don't make that eye contact, like you're acting like you're nervous, you're gone. But that eye contact makes such a difference, and so that's something that's really important to maintain. We don't want to judge. We've mentioned that too. We don't know what's going through their head. We don't know if acting unreasonable or feeling sorry for themselves or vulnerable or they're fearful. We don't know any of that. We don't know what their preconceived ideas are. They have a life, they have a history, they have a cultural background. We're coming in with a different life, a different history, different cultural background, and we don't want to take it personally. We want to try to understand we also don't want to be disrespected. But, you know, and that's important. It's very important. And that's when you call the office and say, hey, this is not working. They're really being disrespectful to me. But we want to try to understand where they're coming from. We want to, again, treat people with respect and dignity, no matter how the person is treating us. And if they're showing contempt, it doesn't matter. Because if we don't treat them with respect and decency and model the behavior they want model the behavior for them that we want them to engage with us, then they're not going to get it. If we're just, disrespectful back, then we're just going to escalate the situation. Again, we want to stay professional because we are the professionals in the room. And we want to stay calm. When a situation is emotionally charged, it's easy to get caught up in the heat of the moment, okay? And we want to remember that the client is losing control, and we want to give that control back to them. We want to monitor our breathing, take slow, deep breaths, sometimes just breathing slowly, silence and breathing, so they can see us calming ourselves down, might then, have them start to breathe and match your breathing and calm them down. Sometimes that works, especially, again, with our dementia clients who are reading our body language. If we do that calming breath and we do that calming state, they might mirror that. Know your strengths. You've got them. And you need to keep control in that situation and use your knowledge, because this is a wealth of knowledge in this room, and use your strengths to find a way to calm the client down. Okay, we want to look for the hidden need. Again, what are we missing? Are they just seeking attention? Do they feel like they need to escape from the room? Is it to gain some kind of tangible thing from you? Are they trying to get something from you or get you to do something for them? Are they just expressing feelings that all of a sudden they're just feeling and they're just expressing them? Are they trying to communicate with you? Are they feeling anxious? Are they? And again, control is a big thing. And that's when I was researching this to put this together, and I'm thinking, that's like a light bulb that went off in my head. When we feel like we're out of control, then we react. And so if we can find ways always to give control back, then we can help them. So, do they need to go to the bathroom? Are they hungry? Did they just have a bad night? Okay. We want to look for others around who might help, especially if the situation is really escalating and becoming untenable. Is there a family member there that can help, right? That can say, look, honey, this is what you got to do. We're going to bring the toothbrush to you. We're going to do whatever you need to do, but we're going to do it this way. Or call your client care manager. Remember, use them. They are there in the field for you. They are your managers. They are your support system in the field. You always want to call them. You don't want to demand compliance, right? I mean, they don't care what we want, right? And for us to try and say, you got to do it because I'm telling you to do it. I mean, they're not children, right? They're adults. Even if you've got a dementia client who's acting like a 2-year-old, they're still an adult. They still have a history and a life. And you don't want to demand, you don't want to belittle them. You don't want to tell them what to do. I can't tell you how many times someone has said to me, just calm down, and I look at them and say, well, I'm not going to say what I say to them, but it's like, don't tell me to calm down. I'll calm down when I'm good and ready to calm down, right? And that's just me out in the field, right? So, it's all this escalation. Sometimes, like we said earlier, they just need to vent. Let them vent. Let them get it out of their system. And saying I understand sometimes is not the right thing to say. We think we want to say that to calm them down, but you don't understand what I'm going through. You think you do? Really? No, come on, you don't. Come on, really. So say to them, tell me some more so that I can understand, or can you tell me what you need? Questions like that, where you're just pulling the information from them and allowing them, again, to take control of the situation. We want to avoid smiling. Like, I know sometimes humor works, but sometimes it doesn't work. In a situation where it's escalating, if you're smiling, or someone may say, why are you laughing at me? What's going on here? So we don't want to be nasty, but we may not want to just smile and joke, because it may backfire on us. And we don't want to act defensively. And again, we've said this already. It's tough. We're not enjoying the situation that we're in. And we need to remember it's not about us. We don't need to defend ourselves. We don't need to protect ourselves unless it gets physical. But in general, we don't want to take it personally. We don't want to be defensive. It's all about what's going on in the client's head. All about that. And it may have nothing in the world to do with us. And again, we don't want to return anger with anger. Okay, that's just going to escalate it even more. We don't want to raise our voice. We don't want to point a finger. We don't want to be accusatory. We don't want to be disrespectful. All of those things. We just want to let them say what they need to say. Wait until they take a breath. Let them settle down. But we do need to know our clients' triggers, right? I mean, that's really important. And again, keep going back, especially with our dementia clients. You know, we want to know when their needs are not being met because that's what's going to trigger these behaviors. We need to know whether it's, again, attention seeking, whether they're feeling disrespected, whether they need to go to the bathroom, whether they need to eat something, whether there's something that they need that they can't tell us. And we need to be like these beautiful, intuitive people that can figure all these questions out and all these answers out and know exactly what they need without letting them know that we're telling them what they need and get the situation resolved. And then don't argue or try to convince the other person of anything. It's just not going to work. We want to keep extra space between us. Okay, if your instinct says that they're not coming down and you're concerned about what's going on, you want to make sure that, you're not too close because that might be misinterpreted as coming against them. And so we want to make sure that there's that space. We can utilize timeout, Timeout is beautiful. It's not just for our kids. It works for our clients as well. It works for all of us. If you're in a personal relationship and you're having a fight, sometimes just saying, I need to go take a break for a minute. I'll be back when I'm calmer and we can talk about this. So there are ways that we can utilize that. We want to set limits and set boundaries. Okay? There's ways that we can do this. And you can say to someone, you're being really disrespectful. Please don't talk to me that way. But it's the way you say it to them. They may not even realize it. And sometimes maybe if you just look at them calmly and say, you're being disrespectful, please don't talk to me that way, they're going to say, I didn't mean that. Maybe they won't, but maybe they will. Maybe they just don't realize that they're being disrespectful. Maybe, like one of us said earlier, that's how they talk. Michael said, that's how they talk to their kids. They may not realize that you're seeing it as disrespect. Apologize, take responsibility, especially in your dementia clients, because they don't realize that they're misrepresenting reality to you, right? And sometimes they're going to say something and they truly believe what they're saying, and you cannot argue with them. If they're being delusional, if they're hallucinating, there's no way you're going to say to them, that's not real, that's not happening. So you just say, okay, I'm sorry. I'm going to fix this. How would you like me to fix this? What can I do to make it better for you? I remember we were just doing an Alzheimer's workshop, and one of the caregivers said, the client would get out of bed because she thought the dog was down there and the dog was going to bite her. And she said, so I just pretended to take the dog out of the room, and I came back and she got out of bed. I mean, it was that simple, Sometimes, especially again with our dementia clients, their reality is so skewed because of what's going on in their brains that you can't argue with them. They believe what they're telling you to be the truth, and they're not going to change that. Always trust your instincts. You guys have been, caregivers for a long time. You can tell when something's going downhill. You can tell when you're losing control of the situation. And always trust your instincts and know how to get out of the situation. Know where the door is to walk out, know where the phone is to call, whatever you need to do. But trust your instincts. And again, remember, one response doesn't fit all. It's not a one size everyone wears, because we have to remain flexible. We have to understand that these are guidelines, but these guidelines may not work in every situation. Every situation is unique. Every person is unique. This whole de-escalation concept is a guideline to work with, but it doesn't necessarily, nothing is black and white. Nothing is always the way we expect it to be. You want to debrief. Anytime you have a situation for your own health, your own well-being, you want to debrief. You want to call someone and you want to talk about it. You can call the office, you can call your care manager. You can talk to your husband, your wife, a friend. But you need to talk through the situation so you can let it go. So that it's not in your head and you're not ruminating about it 10 hours later just because the client had a bad day, right? You want to discharge your own stress, and this goes along with that. You want to find some way to relax that adrenaline because you were in a fight-flight response, right? You had your sympathetic nervous system activated because you're in this stressful situation. So you want to find a way to calm yourself down. So you know what your calming situations are. If you have a dog, take a walk, Just walk out. I mean, we have beautiful metro parks except in the winter in Ohio. Being outside in nature is good. Yoga, Tai Chi, meditation. I mean, all of those things. Ride a bike. Whatever you need to do. Turn on the TV and watch a silly game show if that's what you do to relax. But find something so that you can calm that adrenaline down and you can get your parasympathetic nervous system back in and get out of that sympathetic fight-flight response that you've been dealing with all day. And always give yourself credit for going through an uncomfortable situation. I think caregiving is one of the hardest jobs anyone, anywhere can ever do. And I think it's not respected the way it should be in this country, in this society. And it's really, really hard. And we do a lot. And we are in a lot of uncomfortable situations. It may not be that a client is escalating, but there are a lot of situations where we are navigating and it's not really comfortable. And we're finding a way to manage it so that we can do our job. So we need to give ourselves credit for what we do, because what we do is really, really remarkable. And self-care is probably one of the most important things that we can do to help ourselves. I mean, we need to stay cool, we need to sleep. We don't want to deal with sleep deprivation or our own pain or our own stress, because we can't care for others if we're going through all of that. Okay, so other approaches that we can use for ourselves, right? To help, and even for our clients too. Exercise and physical therapy is good. And I think physical therapy is like the be all to end all. And when I was told to do it for myself, I never did it. So I'm just like your patients, your clients. But there's so many things that it does. Even if we get our clients up and moving, it's going to help them with their flexibility, their strength, their coordination. Walking is really good. It's going to help release tension, just help relax them. I mean, and for ourselves too, we can do it along with them. I think it's really, really useful. Music therapy, calming music, or, when I'm really stressed, I put on a 60s mix because that's when I grew up, right? So, that's what I like to hear, and it calms me down. It really does. I put my earbuds in, I take a walk, and it's like, the world is okay again, right? Pet therapy. Some of our clients have pets. Some of you don't like to be around pets, but pet therapy is a big thing, and they use it a lot in hospital now too, and it's effective. Talk therapy, mindfulness meditation, aromatherapy, light therapy, especially in Ohio. Again, we have really dreary, cold, dark winters, so those light lamps are really good for the circadian rhythm the problems that we have because of that, and that can help our clients with their sundowning and the issues that they have there. Relaxation techniques, talk them through it. Have them sit in a chair, close their eyes, have them focus on their breathing, and you do it along with them, and just have them think about a place that makes them happy, that they want to go to. And when they're in that place, have them think about the air and the trees and the water, whatever the senses are that they can use to think about it, and have them stay there for as long as they want to stay there. Or you too, go home and do that for yourselves too. Just sitting and focusing and relaxing and taking yourself out of your body in a meditative state to some place that's calming for you can be really, really effective. Key points to remember. We want to pay attention to early warning signs of escalation and address them. Remember, sometimes if we just start to see that minor agitation in the beginning, we can take care of it from the very, very beginning and not ever have to deal with it. Tense situations can be diffused with active listening and problem solving. So remember again, the logic to de-escalation is that if you take the authoritative confrontational approach, you're going to have more control, but you're taking that approach away from that control away from your clients. You want to try and give the client a sense of control back, however you need to do that. They're not using their normal coping mechanisms at the time, so you want to find a way to give them that control back so they can engage with their normal coping mechanisms so you can de-escalate the situation. One response doesn't fit all. You need to be flexible. Flexibility and tolerance of frustration are skills that we can develop. If we had a bad day, we had a fight with someone close to us at home, we're going to walk into a situation where we're not going to be flexible, we're not going to be tolerant. We need to remember where we're coming from too and try and put that aside. And that's really hard to do, but sometimes we just have to do that. How we perceive the behavior is how we're going to respond to it. So we want to try and frame it in a way that we're not perceiving our client's behavior as a threat. And we don't want to get into power struggles. They're just not worth it. And sometimes people just want to get into power struggles, right? We all know those people who just like to fight and argue, just for the sake of arguing and fighting. And it's really exhausting. So we just, that's okay. You want to be in control? Take it. You want to be the one that's right? You're right. It doesn't matter. Because it doesn't matter in this situation. We have a job to do and we want to do it. And we want to remember that if the situation escalates beyond our control, we want to ask for help, right? We can't do it all by ourselves. We really can't. So we don't have to try. So if you feel like you want more experience with escalation, you can get more support from your colleagues. You can ask a mentor or a staff for advice on any situation that you're dealing with. There's trainings from communications professionals. There's a ton of stuff on the internet about this. Researching body language and its impact. There's a lot of stuff about that. Learn how to control your breathing in stressful situations. So again, biofeedback. Breathing, when I taught yoga and meditation, and when I taught the meditation classes, I probably spent the first 15 minutes of each session talking about breathing. Breathing is something that is we do it every day, and we don't pay attention to it. But if you do intentional breathing, and you sit there and you calm yourself down with your breath, you're activating your parasympathetic nervous system, you're activating the component of your nervous system that calms you down. And a lot of times, like I said earlier, if you just sit there and deep breathe quietly with your patient, with your client, they're going to mirror that behavior and they're going to calm down because breathing calms us down. Deep, slow breaths are very, very healing and very, very soothing. You want to understand that you have a right to be safe, you have a right to be treated with respect, and we know that, and we don't want to let people disrespect us. Well, and we want to learn to set boundaries around abusive behavior, but we want to set them to protect ourselves, and we want to set them honestly. We don't want to just set them to not deal with a client. We want to be sure about how we're setting those boundaries and what they mean, and then we want to stick with them, right? We don't want to let the clients go over the boundaries, and even in our personal life, when we have people that try to violate our boundaries. We need to know what our boundaries are. We need to know what our limits are so that we can effectively interact with people. So I love this quote. Whatever you fight, you strengthen, and what you resist persists, right? So confrontation is not effective. It's not effective. And so we want to find a way to, yeah, I love it.
Sorry.
That's okay. No, that's perfect. I mean, Toll's great. There's so much wisdom in his stuff. So, any questions, guys? That's what I got for you today. Y'all were great. Yeah, I mean, really, you're great, and you were great at the interaction part. And all of this, right? All of this, and it's just reinforcing what we already know and how we have to behave. But just remember, it's never about us. It's always about the client whatever's going on in their head and their lack of control. So if we can just keep thinking in your head, okay, how can I give that client control back of this situation so that I can de-escalate the situation, you know, respectfully and without an issue. Thank you, guys. Thanks for coming. Oh, wait a minute. No, you got a quiz. Sorry, guys. I totally forgot about that. We'll do it together like we always do. No, because it's so be for little bit. They were screaming when I got to do the nursery. And then they would make you take it the next time you go to another workshop, right? Oh, boy. You want my copy of this? Please. Okay, so the first question, what's your name? And do we know today's fake house?
Behave.
Okay, good. Okay, so number 3. Signs of conflict escalation include all but the following: anger, accusations, and blaming. Issues multiply. Issues become clouded so that nothing is right. There is no impasse. Everyone cooperates. The answer is D. That's the only one that doesn't fit.
D.
Huh? D. D is in David. Commonly encountered elderly behaviors include A, resistance to showers and hygiene, B, general uncooperativeness, C, aggression and violence, D, paranoia, hallucinations and delusions, confusions.
Oh, the E?
E, all of the above. Number 5, as a care pro, it's important when dealing with a challenging situation to isolate the cause of the behavior. True or false?
False.
No, true. You want to isolate the cause of the behavior. Misread it.
That's true.
You want to find out what the trigger is, yeah.
Yes, that's
Yeah,
true. I'm sorry.
yeah, that's okay. Number 6, behavioral techniques for managing a challenging situation include A, listening without distraction.
All of the
All of the above, yeah. E, using reflective questioning, watching your body language, and staying calm. Number 7, raising your voice, pointing your finger, and
False.
speaking disrespectfully are acceptable ways to manage a challenging situation. Yes, false. Number 8, other approaches to managing a challenging situation include
E.
E, all of the above: exercise therapy, music therapy, mindfulness, meditation, aroma, and light therapy. Number 9, you should always pay attention to the early
True.
warning signs of escalation and address them. True. Number 8, remember that you do not need to be flexible in your response. One response fits all. False. Number 11, in challenging situations, remember you are trying to give the client back a sense of control because their normal coping measures are not working. True.
True.
And the last one, if the situation escalates beyond your control, you should ask for help.
True.
True. Okay. Now you're done.